and I'm Kendra Hall, and we'd like to interview you today for our law class.
Okay, sounds great.
All right, so let's begin.
All right.
What's your background before starting pharmacy school? Were you a pharmacy tech or something like that?
Actually, before pharmacy school, I wasn't a pharmacy tech. I did become a tech intern until I started pharmacy school. So prior to that, I didn't really have a whole lot of pharmacy experience. Had family friends who were pharmacists, but I had never really worked in a pharmacy or anything like that.
Okay. When did you choose to do pharmacy and why?
I chose to do pharmacy in my first year, end of my first year, maybe beginning of my second year in college. I was initially all gung-ho, wanted to do medicine, then thought about the hours, thought about some of the constraints that were happening in the profession in terms of doctors, and then I actually shadowed a physician and also spent some time. I volunteered at Tulane University. I'm from New Orleans, and so that was one of the major medical schools in the state, and they have a huge hospital along with their medical school, and so I volunteered. And so I wanted to make sure that this was something that I was really interested in, and I realized I didn't like it that much. And so I started doing more exploration. I knew I liked math and science, I knew I liked the body and health, and I knew that I wanted to be in the health field. But once I realized that I really did not want to do all that it took to be a physician, I thought about, well, where else could I use my time and talents? And so I learned from the college that I attended that actually had a pharmacy school that I should consider pharmacy.
Who was your greatest influence?
To become a pharmacist?
Mm-hmm.
I would answer that by saying my greatest influence to remain in my chosen profession while I was in pharmacy school was a pharmacist by the name of Michelle Coulon. And she was a phenomenal pharmacist. She's now deceased, but she was extremely impactful for me in terms of letting me know this is what pharmacy is all about, and making a difference in patients' lives is what you can do on an everyday occurrence. Because she was just a really great person to take care of her patients, and more times than not, patients loved her and would not want her partner to fill their prescriptions because they wanted Michelle to fill their prescriptions, and she was just always willing to go that extra mile for patients. And so a lot of what I developed my mindset in terms of the type of pharmacist I wanted to be was based on how she, in fact, practiced the profession.
So what types of pharmacies have you worked in?
I've worked in community pharmacy. I've worked as a consultant pharmacist. And primarily, the majority of my experience has been in community pharmacy. When I did residency, I also worked in hospital pharmacy and psychiatric pharmacy. And then I volunteered in a free clinic. And so in a pharmacy that was licensed, registered through the Board of Pharmacy. This was in Virginia. But its practice was a little bit different than your traditional community or hospital pharmacy.
Which area did you enjoy the most, and why did you enjoy it?
That's a hard one. I really enjoyed working in the free clinics. And the people were the most needy in terms of their access to health care. Sometimes their educational experiences were much different and not as advanced. But they really wanted your help. And so I really realized that the difference that we can make if we take the time and if we're willing to shed our biases about situations can really be impactful.
So teaching is said to be rewarding in terms of satisfaction. Financially, it can be taxing. Why did you decide to teach?
Good question. Both my parents are educators. And so from even a very young age, I was always around persons who enjoyed sharing information to others and really enjoyed seeing the light bulb go off. So like with my mom and dad, a lot of times they'd ask you questions, and it wasn't just a simple answer. It became, an odyssey and a voyage to why is it that answer and not this answer, and what do you think about this and what about that? So it was that's always been a lot of how I've experienced growing up. And so when I was in pharmacy school, actually, in my second to last year, they had 2 or 3 faculty members who had mentioned to me on different occasions, because I was also a TA, that we had that opportunity for pharmacy students, select pharmacy students, to also be sort of like a teacher's assistant in the labs and different things like that. And they said, Michelle, you ought to consider teaching. I was like, no way, I don't want to do that. Are you kidding me? My parents are educators. I want as far away from that as you can possibly imagine. But it wasn't until I started practicing pharmacy and had the opportunity to precept students and realized that as I was precepting students, I would do the different things that some preceptors will do and others won't, and I would create little quizzes for my students on rotations, and we would make things, any of the major concepts, we would make that a true learning experience. I would have the students watch me do things, and then I would have them do it with me standing right there, guiding them, helping them. And I just love that. I just thought that was really fun, and I had the relationship with the patients that they didn't mind helping the students learn and grow as well. And so for me, I realized that was something that I really enjoyed. And a lot of this was happening in New Orleans when I was still living and practicing pharmacy in New Orleans, and then there was a couple of opportunities at the College of Pharmacy where I graduated for teaching opportunities. And I applied for some of those opportunities, and they said, Michelle, you're great, but at the time I only had a bachelor's degree in pharmacy, and they said, you really need the PharmD degree, and you need probably a residency as well. And as I thought more and more about it, explored those opportunities, I realized they were absolutely right, that I did need some of those experiences in order to make me a better guide for students.
How has pharmacy changed since you started practicing?
Pharmacy has made a big change in several different ways. When I first started practicing pharmacy, you didn't really have a whole lot of pharmacy benefits management, PBMs. The insurance process was starting to change, and we were starting to see how it was in fact impacting our ability or our time, the availability that we had to talk with customers, as well as customers' choices on their medications. And then drive-thrus came around, and so that was quite a change and quite a shift to one, how the public views pharmacy. I'm not sure that it helps us a whole lot to have drive-through windows in pharmacy, but I also understand the business side, that it's also business decisions that companies make to meet what the public demands, and many times that is they want things convenient, quick, fast. And so while I understand that, but something as important as medications and health, for me, it was very much a push-pull kind of situation.
So pharmacy practice has been greatly impacted by the change, especially with technology advances, new laws such as the Obamacare laws, and the ability to counsel patients. What impacted you the most since you started?
Of those, I would say that the experiences that I've had would probably be the most with over 90 and the requirement for counseling. That did very much change what we did, how we delivered information to patients. I would say that depending on, until I got my own store, when I floated the different pharmacies had different ways in which they implemented the requirement for counseling. And so that was a big change. I think it's a good thing. I'm not sure that as a profession we are fully realizing that opportunity and making the most of that opportunity. I think that time constraints and pressures and things of that nature are always a competing force for the pharmacist to how do you balance, the extra time that it takes versus prioritizing the need that patients have. Also with your company's position and desire for pharmacists to fill as many prescriptions as possible in a timely fashion. So for me, that's where I saw the biggest impact. Obamacare did not or has not affected me because most of the time, I'm doing more academic administrative activities, and so I don't see the impact of it directly. Indirectly, I think it's going to afford pharmacists the opportunity to do more, to expand our roles and increase our roles if we take full advantage of the opportunities that are coming forth as a result of that.
So how do you see practice of pharmacy changing in the future?
I think that this is one of the most exciting times for the profession because there is a lot of change that's coming down the pike. I think the persons who have the right attitudes and who are getting the appropriate training and are aggressive and assertive in making sure that pharmacy is able to do things that we're trained to be able to do, that it's a very exciting time because as I'm seeing more and more emphasis on value-based provision of care. That's an area where pharmacists can provide a great deal of contribution because as the whole healthcare system is moving away from reimbursing providers for the product or reimbursing providers for the activities that they perform, an X-ray, a CAT scan, or these kinds of things, they are billed, and so it's beneficial and it's conducive more for the provider to have all of these activities versus value-based. So, if you get compensated, reimbursed, and you're able to bill based on how well you keep a patient, then you're going to need other types of providers to help you manage patients and to help patients do a better job with their medications. And so that's where pharmacists come in. That's our playground, and that's where we can really provide a lot of benefit and value to patients. And so I see the horizon being very bright from that perspective.
All right, last question.
Sure.
So why did you choose academia here at UCSOB?
Good question. It was a great opportunity. It was 10 years ago, in fact, that I had the opportunity to join the team here at the University of Charleston. It was an opportunity for me to increase the types of activities and contributions that I was making to the academy. My previous position before coming to UC was as a director of experiential education, so I did what Dr. Tessman does for our program now. I had a real interest in several subjects and areas and topics, but one was really about professionalism and the importance of professionalism to the profession of pharmacy and its delivery of its impact in the delivery of patient care. And so I've done some posters and one or two articles and caught the eye of the founding dean here at UC, and was invited to come apply for a position as assistant dean for professional and student affairs, and came and looked at the campus and looked at Charleston and said, I think I'd like to try this. And so that's how I came to the University of Charleston School of Pharmacy. Started out as an assistant dean for student affairs.
On behalf of Group 16, thank you very much for letting us interview you.
Well, thank you for the opportunity. I appreciate the ask.